your knees feeling lately? If you are above a certain age, they probably don't feel as good as they used to back in your youth, but you're in the right place this morning. I'm with Dr. Chris Gettle, who specializes in a procedure that can help you feel better. And we're talking about GAE. Thanks for having us today.
Yeah, thank you for having me.
Knee pain is affecting a lot of people for various reasons, and you guys have this procedure that can help. What is GAE?
Right, so GAE stands for Genicular Artery Embolization, and it's a minimally invasive technique to treat people who have chronic knee pain and usually osteoarthritis as the cause of that knee pain.
Okay, so who would be the ideal candidate for this? Is it somebody who is a little more advanced in age, typically?
Often, yeah. It's typically middle-aged or older adults that are having a lot of pain and have had a lot of wear and tear on the knee over the years. And for us, many of our patients are patients that don't want to have a full knee replacement or can't qualify for a knee replacement because of other medical problems.
So maybe they've been on medication to manage the pain and now they're like, something else needs to happen here.
Exactly.
Okay, so walk me through this procedure. You said minimally invasive. What can I expect if I'm going to have this done?
Sure. So the procedure is an outpatient procedure. We usually do it here in our clinic, and we do it with IV sedation. So we don't need to put the patient under general anesthesia. And the procedure itself lasts about an hour, sometimes a little bit less than an hour.
That's not bad. Okay.
And then after the procedure, the patient recovers here in the clinic. We just make sure everything's looking good, and then you go home later that day.
Okay, so when you're working on the knee, and explain to me the science behind it. What's happening in there?
Yes, good question. It's a technique that came out of Japan, actually, about 15 or 20 years ago. And it's actually a treatment that we do through the arteries. So we put a small catheter in, usually through the hip artery, and we steer it down toward the knee with an X-ray camera. And we find the little small arteries that go around the knee joint and supply the inflamed and painful joint. And then we find little tiny arteries and inject particles into those arteries to decrease the inflammation and decrease the pain.
Okay, because that inflammation is what's causing the discomfort, right?
Exactly. We think, and there's a lot of research ongoing in the area, but we believe that injecting these particles and decreasing these inflammatory neovessels around the knee, that it basically dials down the inflammation and dials down the pain, kind of like turning a knob down on speakers.
All right, and these patients have been wanting to crank down that knob for a long time, right? So you touched on the recovery a little bit here in the office. They have to wait, obviously, until they come to. Somebody else will drive them home. Beyond that, what can they expect for recovery?
Yeah, usually a little bit of mild soreness or stiffness in the knee for a couple days, but it's pretty self-limited. And then pain scores tend to go down anywhere from 1 to 4 weeks after the procedure. So within a pretty short period of time, most people feel some improvement in their knee pain. And then interestingly, sometimes that improvement can continue for many months. So people report lower and lower pain scores.
Okay, and they'll be feeling better for at least a few years, right? This is something that's going to last.
Yeah, so we think of this as kind of an in-between from joint injections and a total knee arthroplasty. So unlike steroid or other joint injections that usually last weeks to maybe a couple months, with GAE we want to get many months or even a couple of years of relief out of the procedure. So it's a little bit longer, a little bit more durable than some of the other treatments.
Yeah, but life-changing to not have that knee pain, not have to get those shots, right? I bet you see some very happy patients after this.
Yes, that's true. Yeah, our patients are really satisfied, and it's a nice way to get some relief without taking a lot of risk, like a big surgery, basically.
Good information. Dr. Gettle, thank you so much. If you would like more information about this procedure or to contact the team of doctors at Vascular and Interventional Partners, you can call the number on your screen or visit VIPinterventional.com.